I'm Dr. Alex Carter, and if you want to know exactly what your blood type says about how your body ages, drop your blood type in the comments below and don't forget to subscribe so you never miss this kind of information. Your blood type is printed on a card that's been sitting in a drawer for 30 years. And there is a growing body of peer-reviewed research tracking hundreds of thousands of people over multiple decades that says that card contains a biological fingerprint. A fingerprint that predicts, with measurable statistical probability, how your body will begin to fail after 60. Not in the way diet books talk about blood type. Not in the way wellness influencers talk about it. In the way that epidemiologists, publishing in journals you've never heard of, have been quietly documenting for years. Today I'm going to walk through every blood type, O, A, B, and AB. And for each one, I'm going to tell you something most physicians will never say in a routine checkup. And I'm going to stay right here to the end because there's a modifier, something beyond the letter on that card, that changes your personal risk profile significantly. Most people have never thought about it once. So, what's your blood type? Drop it in the comments right now, because what comes next is going to mean something very different depending on your answer. Let me ask you something uncomfortable. If you walked out of your doctor's office today and they said, based on your specific biology, here is the single most statistically likely way your body will begin to break down in the next 20 years, would you want to know? Most people say yes, then they spend the next decade ignoring the exact information that could prevent it. Here's what I found after years working in preventive medicine. The piece of data that unlocks this conversation is something every person in this country has had since the moment they were born. Blood type. Not as pseudoscience, not as diet advice, as a measurable biological marker that leaves a fingerprint on your cardiovascular system, your brain, your immune function, and your digestive health. And the research on this is not theory. It is peer-reviewed, it is replicated across populations of hundreds of thousands, and it is almost entirely absent from the 15-minute appointment you get once a year. I'm going to fix that right now. One condition, stay with me until the end. Because the final piece, the Rh modifier sitting on top of every blood type, is the one variable nobody includes in these conversations. And it matters more than most people realize. Let's start with type O, and I want to reframe this completely from what you've heard before. Type O is the oldest blood type on Earth. It emerged in humanity's earliest ancestral populations, built for endurance, built to resist parasitic infection, built to process large amounts of animal protein under physical stress. That ancient blueprint left a gift inside every type O body walking around today. Type O individuals carry lower circulating levels of von Willebrand factor, a clotting protein. Less clotting activity means smoother blood flow, less platelet aggregation, and a statistically meaningful lower risk of the arterial blockages behind heart attacks and ischemic strokes. Multiple large-scale studies confirm it. Type O carries the lowest coronary artery disease risk of any blood group. That is real. That is documented. Now here's what nobody tells you about that gift. It becomes a trap. I've watched this pattern play out more times than I can count. A type O man or woman comes in at 57 or 58. Blood pressure is fine. Cholesterol is manageable. No family history of heart disease. And because they feel structurally protected, they stop paying attention. They ignore the fatigue. They push through the digestive discomfort. They dismiss the joint pain. Because the cardiovascular system isn't where type O's body quietly falls apart. It's the stomach. Type O's gastric lining expresses surface receptors that H. pylori, the bacterium responsible for the majority of peptic ulcers and a significant percentage of gastric cancers, finds easier to attach to than any other blood type. H. pylori doesn't announce itself with dramatic pain. It moves in silently. It colonizes the gastric mucosa, and over years, sometimes decades, it erodes the protective lining of the stomach from the inside. Left undetected, chronic gastritis, then peptic ulcers, then, in a meaningful percentage of cases, gastric cancer. Caught late. That is one of the most difficult cancers to treat successfully. This is documented. This is not theory. If you are type O and over 55 and you have never been tested for H. pylori, that is your most important conversation this year. Stool antigen test. Breath test. Inexpensive. Often covered. Specific to your biology. Here is your protocol if you're type O. Limit long-term NSAID use. Ibuprofen, aspirin. These drugs erode gastric lining in everyone. In type O, they land on tissue already operating at higher biological risk. Add fermented foods consistently. Kefir, miso, kimchi, naturally fermented pickles, not trends. Practical tools for maintaining a gastric environment that is more resistant to bacterial colonization. Move your body. Type O is associated with higher baseline catecholamine activity. More dopamine, more norepinephrine. When that energy has no physical outlet, it converts to restlessness, cortisol dysregulation, disrupted sleep, 30 minutes of walking daily, 2 sessions of resistance training per week. That combination will do more for your long-term metabolic health than anything in a supplement aisle. Type O, cardiovascular strength is your inheritance. Your stomach is your responsibility. Don't let the first make you complacent about the second. Now, Type A. And I want you to lean in here, because this is the blood type where the gap between what people know and what they actually need to know is the widest. Type A emerged as human populations shifted toward agriculture. Denser settlements, more complex social environments, broader exposure to infectious agents. The immune system adapted, and Type A individuals developed aggressive, effective responses, particularly against viral pathogens. In your 20s and 30s, that is a biological asset. But here's where the story gets complicated, because what protects you in your 30s begins to compound against you in a completely different way by your 60s. Type A blood carries higher coagulation activity, stickier platelets, more active clotting proteins. A landmark Harvard study tracking 9,500 adults over 20 years found that Type A individuals carry a statistically elevated risk of coronary heart disease compared to Type O. Now, that number in isolation sounds manageable. Here's what makes it dangerous for Type A specifically. Type A individuals maintain the highest baseline cortisol levels of any blood type. Cortisol is your primary stress hormone. Short bursts, useful. It sharpens focus, mobilizes glucose, prepares the body for a challenge. But when cortisol runs chronically elevated, week after week, month after month, it does something very precise to your arterial health. It inflames and stiffens the endothelium, the thin inner lining of your blood vessels. And here is the mechanism that should concern every Type A person watching this. When your endothelium is inflamed, when it loses elasticity, it becomes a surface that sticky, hypercoagulable Type A platelets preferentially adhere to. The elevated clotting activity of Type A blood and the chronic cortisol-driven endothelial inflammation of Type A physiology are not two separate risk factors. They are a compounding cycle. Each one makes the other more dangerous. What this means practically is that for Type A individuals, stress management is not a wellness preference. It is direct cardiovascular medicine. It belongs in the same category as blood pressure medication and cholesterol management, because physiologically, it is addressing the same underlying pathway. Here is your protocol if you're Type A. Blood pressure monitoring every 6 months, not annually. That is appropriate clinical tracking for your specific biology. Ask your doctor to include homocysteine in your next blood panel. It is an amino acid that, when elevated, actively damages arterial walls. Type A individuals trend higher. The intervention is remarkably simple. Folate, B12, and B6, found in dark leafy greens, eggs, legumes, and lean protein. Build a daily cortisol reset practice, not a weekend retreat, not an occasional meditation, something you do every single morning before the day gets its hands on you. Diaphragmatic breathing, 4 seconds in, 6 seconds out, practiced consistently for 10 minutes, has measurable effects on cortisol regulation in clinical studies. 5 minutes every morning outperforms an hour on Sunday by a significant margin. Type A, powerful immune resilience. Elevated cardiovascular risk driven by a stress hormone that your blood type keeps chronically elevated. Managing that hormone is the most important health decision you will make this decade. Type B, the blood type that conventional medicine understands the least, and mainstream wellness culture handles the worst. Type B emerged among nomadic populations moving across Central Asia and the Himalayas. People constantly adapting. New food environments, new climates, new infectious pressures. The immune system that developed out of that pressure is genuinely remarkable. Type B individuals can efficiently process a wider variety of proteins, fats, and carbohydrates without the inflammatory friction that other blood types produce in response to dietary variation. That adaptability is real. In the context of evolution, it was a profound advantage. But here is the clinical problem that most Type B individuals over 55 are carrying around without knowing it. That same highly adaptive immune system, the one that was built to handle enormous environmental variation, doesn't always know when to stop adapting. Research shows that Type B individuals carry a measurably different gut microbiome composition, and specific inflammatory dietary inputs, refined seed oils, ultra-processed foods, high fructose corn syrup, appear to generate stronger systemic inflammatory responses in Type B compared to other blood groups. The modern food supply is, effectively, a calibration problem for the Type B immune system. These are not just empty calories. For type B, research points to these inputs as particularly potent triggers of systemic low-grade inflammation, the kind that runs below the surface for years and progressively distorts immune precision. Here is what that looks like in practice. Fatigue that doctors cannot explain, joint stiffness blamed on aging, skin conditions that seem unrelated, recurring inflammation without an obvious cause, dismissed for years as just getting older. If any of that sounds familiar, this deserves direct attention, not a lifestyle shrug. Your C-reactive protein level, a standard inflammatory marker available on a routine blood panel, should be monitored at least annually. A CRP reading consistently above 1 milligram per liter without an obvious acute infection is a meaningful signal. Your immune system is running in a chronically activated state. You need to find what is feeding it before it finds you. Here's your protocol if you're type B. Eliminate the inflammatory inputs first. Refined seed oils, ultra-processed foods, high-fructose corn syrup. For type B, this is not general nutrition advice. It is targeted immune management. Move consistently, not intensely. Type B physiology responds significantly better to sustained moderate-intensity movement, cycling, swimming, hiking, consistent walking, than to repeated high-intensity bursts that spike inflammatory markers during recovery. Get annual CRP monitoring, not as a precaution, as a tracking tool. Type B, the most metabolically adaptable blood type on Earth. Keep that immune system precisely calibrated and it is your greatest asset. Let it run unchecked and it becomes your most serious vulnerability. Type AB, the youngest blood type in human history. It appeared relatively recently, when populations carrying A and B antigens began mixing at scale. And because of that dual inheritance, it carries the most unusual immunological profile of any blood group. On one side, AB inherited immune tolerance characteristics from both parent types. AB individuals show reduced inflammatory responses to certain environmental antigens, meaningfully lower risk of some gastrointestinal cancers. That is a genuine advantage. But what type AB gained in immune tolerance, it carries a significant cost in neurological vulnerability. And the research on this has become increasingly difficult to ignore. Type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to type O. This is not a fringe finding. It is replicated. The mechanism is cerebrovascular. Type AB blood carries elevated coagulation factors inherited from its A component, combined with the complexity of the AB antigen profile. Over decades, this creates subtle but cumulative changes in blood flow through the brain's smallest capillaries, the microvessels that service the regions responsible for memory consolidation, processing speed, and executive function. These are not dramatic blockages. They are microscopic, gradual changes in perfusion efficiency across neural tissue. Most people would never notice until the cumulative effect has been building for 15 or 20 years. This is why, for type AB, cardiovascular health and brain health are not two separate conversations. They are identical. Every intervention that protects your arteries simultaneously protects your cognitive longevity. Blood pressure control, blood glucose management, cholesterol and triglyceride monitoring. This is not abstract prevention. For type AB, this is neuroprotection. Here is your protocol if you're type AB. DHA, the long-chain omega-3 found in fatty fish, salmon, sardines, mackerel. It incorporates directly into neuronal cell membranes. It maintains membrane fluidity and reduces the neuroinflammatory signaling that accelerates small vessel disease. 2 servings of fatty fish per week, or a high-quality fish oil supplement discussed with your doctor. For type AB, this is not optional supplementation. It is targeted neuroprotection based on your specific biology. Sleep. 7 to 8 hours every night, non-negotiable. During deep sleep, your brain's glymphatic system flushes out accumulated metabolic byproducts, including the amyloid proteins associated with neurodegeneration. For type AB, chronic sleep restriction is not just fatigue. It is accelerating the exact biological process your blood type already makes you more vulnerable to. Blood pressure below 120/80, consistently, not just when you remember to check it. Type AB, impressive immune tolerance. A brain that requires deliberate, consistent, long-term defense, beginning now, not at 70. Before I close, there is one more variable, and almost nobody includes this in these conversations. The plus or minus at the end of your blood type designation, Rh positive or Rh negative. Roughly 85% of people are Rh positive. They carry the Rh antigen on the surface of their red blood cells. The remaining 15% are Rh negative, and this difference is not cosmetically minor. Rh-negative individuals appear to carry a modestly different cytokine signaling profile. The chemical language your immune system uses to communicate is calibrated differently. Research is still establishing the full clinical significance, but what is emerging suggests that Rh-negative individuals may have heightened sensitivity to certain inflammatory triggers, which means this. Regardless of your blood type letter, if you are Rh negative and managing any chronic inflammatory condition, the protocols I have outlined today are even more relevant to you. Implement them more rigorously. And if you are an Rh negative woman who is pregnant or planning to become pregnant and your partner may be Rh positive, this is a medically urgent conversation to have with your obstetrician right away. Rh incompatibility during pregnancy is completely manageable. It requires intervention. And it requires that intervention proactively. Know your complete blood type, the letter and the sign. Make sure your physician has both on record. Now, here is the most important thing I'm going to say today. And it is the thing that most blood type content completely avoids. The statistics are real. The risk elevations are documented. The biological mechanisms are genuinely significant, and they are not your destiny. I have watched type AB patients in their mid-70s with sharper cognitive function than colleagues 15 years younger. Not because their genetic risk profile was somehow different, because they understood what their biology was working against, and they built their daily lives around addressing it. They slept 8 hours. They ate fatty fish twice a week. They kept their blood pressure below 120/80 consistently, not just when they remembered. They kept learning genuinely new and challenging things, not casual scrolling, but real cognitive engagement. Their risk was still present. The statistical profile still applied to them. They simply chose to meet it directly, rather than let it accumulate quietly in the background. The gap between genetic predisposition and actual health outcome is not small. It is enormous. And it is filled entirely by choices made consistently over years. That gap is where your decisions live. Your blood type is not a sentence, it is a map. And a map is only useful if you are willing to look at it. Tell me in the comments, what is your blood type, and does the profile I described today match what you have actually been experiencing in your own health over the past few years? I read every single one. And if this gave you something worth acting on, there is another video right here where I go through the 3 most commonly missed root causes of persistent fatigue and high blood pressure in men and women over 55. Conditions that are completely addressable when caught early, and almost always mismanaged when they are not. Take care of yourself. You have carried this body a long time. It is worth understanding exactly how it works.